I really loved that discussion. That was great. Thank you to everyone for participating in that. I'm going to talk a little bit about ways to work on self-help skills. Next slide, please. Definitely want to encourage, any questions throughout this, as well as, sharing any strategies that have worked really well or haven't worked so well. And anything else that you would like to know about self-help skills, I'm happy to discuss. Just a little bit of an overview, going to kind of look into sensory processing, because that definitely impacts self-help routines. We talk a lot about there are some necessary prerequisite skills and other factors that can affect independence with self-help skills. Going to talk a little bit about some functional approaches to support independence, kind of what's expected for age and ability. Things like eating, personal hygiene, bathing, and toileting, and then definitely time for questions and discussions. Next slide, please. Just a little bit of what we talked about last week, just a little bit information about sensory systems review. These are 8 sensory systems. These all will kind of impact self-help skills. So just, each one is definitely represented in all of the activities that we do on a daily routine. Next slide, please. Difficulties and differences with sensory processing can impact participation in self-help and self-care activities. So it's really important to take into consideration a child's sensory preferences when trying to engage them with activities or supporting their independence. And each child's sensory needs are unique. Next slide. Some things that you might see related to self-help skills regarding sensory processing for eating and feeding. You might see if a child's a picky eater, do they mind getting their hands or their face messy? Can they manage more chewable foods or more textured foods? Do they have a very strong preference for the utensils or the type of cup that they use? For personal hygiene, do they accept having their teeth brushed? Can they sequence steps in something like hand washing? Can they tolerate things like haircuts or having their nails trimmed? Things for toileting, do they notice if their diaper is soiled or dirty? Can they independently manage clothing? One thing like, can they tolerate having a diaper on or tolerate wearing certain types of underwear? And are they fearful of sitting on a toilet? Dressing, you might see things like they prefer certain clothing, might prefer a certain type of fabric. They might really dislike tags. They might have difficulty transitioning clothing between seasons. So going from shorts to long pants, or, no hat to having to wear a hat. Can they put on or take any clothes themselves? And do they prefer wearing no shoes, having bare feet? And then for things like bathing, can they help wash body parts? Can they accept having their hair washed? Can they transition easily in and out of the tub? Next slide, please. This is from Self-Help Skills for People with Autism. These are just some skills to look for to see if your child has a readiness to learn some skills, if they're more of a passive participant, or this could be something that you could engage them to be more of an active participant or independence. You want to assess if your child has the building blocks for learning. Really want to consider their interests and abilities. I always want to incorporate things that children are interested in, especially when we're teaching some of these self-help skills. Assess your readiness to teach. If you feel supported by others, if you don't feel supported by others, definitely ask family, friends, therapists, early intervention, those early years, because it is family-based. All of the therapists should be in your home and kind of helping support these self-help routines. Always set a reasonable expectation, and select skills to teach that are functional, appropriate for age and ability, and important to the child and important to you as a family. I say, early on, we expect a child to be able to take off some clothing, not to expect them to put on a coat with the correct orientation, put the zipper together and pull it up. So just kind of getting an idea of what might be appropriate for their age. You want the opportunities for learning, they should challenge your child, but match their developing abilities. Some things that we might see for cues that look like readiness, consistently look when their name is called, pay attention to a direction by stopping what they're doing and look towards the speaker, follow some simple one-step commands like come here or sit down. using some sort of eye contact, almost more like a visual regard. So if we want a child to be able to learn a skill, it's often helpful if they're looking at the activity. So they're looking at what they need to be able to do. Maybe looking at an object when asked, like, hey, look at the plane in the sky. Being able to, and this is going to vary on their age, but just participate in an activity for at least 10 minutes. And I always say, especially for us and for kids, it should be an activity that they're kind of motivated by and they're interested in, not expecting them to kind of like trudge along something that they're really disliking. We want to see kids be able to communicate simple wants and needs, even if it is no, I don't like that. We want them to be able to let us know something feels good or doesn't feel good. Point to common body parts, maybe where's your belly, where's your nose. Respond to physical guidance without distress. I see a lot of kids that initially have a really hard time with just like hands-on touch. So before we might have them learn how to use a spoon to feed themselves, we might have to work on having them accept like touch to their hands first. And then another one that I find is really important is just imitating simple motor actions. Next slide, please. Some other factors and skills that can impact self-care might be some rigidity or a decreased ability to generalize learned skills. So what that might look like is when I talked about only wanting to use one type of spoon, and maybe got really good at using that type of spoon. That spoon's no longer available, and a child can't generalize the skill of how to spoon feed using a different kind of spoon. We want children to be able to anticipate a routine and the awareness of an expectation and contextual cues. So we want them to know when we say, hey, it's time for bed, that they're aware of like, oh, we go to the bathroom, we do the bath, we do toothbrushing. So we want them to start to know that these are kind of the routines that happen towards the end of the day. Sometimes we see children just have the decreased ability to complete the task independently. And this might be because of motor skills. So they might not have the necessary motor skills to perform certain tasks. So things like strength, hand-eye coordination, being able to use a tool to hold and scoop with the spoon. So maybe can do finger feeding so they understand hand to mouth. But then when you incorporate and add the use of a tool, that becomes a little bit more challenging. And then do they have things like the posture necessary or the endurance for tasks? So can they sit upright for 10 minutes in order to play in the tub or in order to feed themselves? Some things else, I just want to point out a couple things that, like, if a child might be a little bit hypersensitive, you might see things like they don't accept things in their mouth, like oral care. They might really hate haircuts. They might really hate having their body washed or their hair washed. They might have difficulty like tolerating the hair dryer, so that sound, they're really hypersensitive to that sound, or tolerating clothing. It might just be like very sensitive to the way clothing feels on their body. And kids that might be a little more hyposensitive, so they're not registering that, they might not dry themselves thoroughly, so they might be soaking wet and not feel that their body is wet. They might wear clothes inside out or shoes on the wrong feet, or they might be wearing shorts when it's 20 degrees outside, and they might not notice if they have food on their face or their hands. Next slide, please. We did talk a lot in case study about the importance of visual supports. So that helps predict what's coming next and reduces associated stress or anxiety. Visual supports are excellent for helping to teach the sequence of steps for self-help tasks. It's also like good for reminders of like all the steps that you need to do or what comes next or what can you do if you don't like this or this is difficult for you. Visual schedules can help create guidelines, rules, expectations for what's to be expected for different routines. So like toothbrushing, for example, you're expected to floss, brush your tongue, brush your teeth, and can really help with an individual's ability to make choices and be more of an active participant or more of an independent participant. So they can make a choice of what kind of toothpaste I want to use. That's going to, if the child doesn't have the skill to brush their own teeth, they at least can use the visual schedule or choices to help kind of direct what toothbrush they want, what toothpaste they want. Next slide, please. So I'm just going to do a couple of suggestions. Broke some of these into older and younger kids. We're going to talk a little bit about, I think everyone's favorite topic is eating and feeding. The biggest thing I'm going to say is to rule out any kind of medical issues. We have allergies, sensitivities, delayed gastric emptying, reflux, intolerances, EOE. That's something that is huge that really needs a team approach to look at. If we're trying to have a child who's a picky eater try food that they have an insense like that they're sensitive to or they're intolerant to, it's just going to make them feel worse. It's going to make us feel worse, and we're not going to see the progress that we want. Some things to try is you use divided plates to help keep foods from touching if your child like really doesn't want foods touching. Trying different types of textures of cloths to wipe hands and face. A mirror is also helpful. Some kids just really don't like smooth paper napkins and do a little bit better with like a rough washcloth to wipe their face. It also provides a little bit more feedback. Mirror is showing some visual cues, so you can kind of also teach an older child like, hey, you have a little bit of food here. They might not be able to feel it, but the mirror is going to tell them like, oh, that's where it is. Okay. If your child is a kid that really gets very distressed when they have mess on their face or on their hands, feed your child. I also often say, like, don't scrape a child's face with a spoon, as that could be aversive. It's also interrupting the meal. So if your child's in a good rhythm of eating and you start scraping or cleaning them midway through, unless your child really gets distressed by being dirty, I would kind of try to save that towards the end. For introducing new foods, always offer foods that are similar in look, color, taste, presentation, texture of the food that your child accepts. Offer a very, very, very small amount of a new food and encourage the child to explore the new foods before tasting them. You never want to go right into, trying to taste that food or make me happy, eat that food. I always say you have to be able to be in the same room with the food before you're going to be able to get anywhere near trying to put that food in your mouth. And for a lot of kids with autism, being in the same room with the food can be very, 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 very difficult. I would say don't mix vegetables and things into foods they already eat. We don't want to ever try to trick a child. A lot of children with autism have they're like super sleuths. They can find anything. They notice any difference. If your child is one of those kids that actually does tolerate having vegetables and other things mixed into things like smoothies, that might be something that you talk with your doctor about, and that might be a way to add some vegetables and maybe some supplements into their diet without they need to actually ingest those foods. And the big thing is, another reason I say try not to hide or trick kids into eating foods is that if they are able to tell, then they're not going to trust whatever you offer. And then any kind of step to teach them something new or ask them to do something new in the future is going to be a lot harder because it's going to be a little bit of a mistrust involved. Next slide, please. Schedule eating times. This helps prevent emotional meltdowns and help a child identify internal feelings. We often talk about kids don't necessarily know if they're hungry or they're full. So by staying to a schedule, we kind of help them learn the way that their body feels. We also prevent some of those things like kids getting hangry. Kids get hangry just like we do. Provide social models of eating. You can use social stories, but a lot of times just having kids watch you eat as a family, watch peers eat at school. I always say go to McDonald's or someplace that has a playland, let the kids watch other kids eating and having fun. And don't be afraid to ask for help for your child's team. So in early intervention, you can get a dietitian. You can also get an outpatient. You can get a dietitian. So you just need to check with your insurance about something like that. Speak to your doctor or the dietitian about supplements or vitamins. And then some of the areas that therapists can also help that include kind of like eating in general would be food exposure, oral motor skills, fine motor skills to support self-feeding. Next slide. For older children, same thing. You want to rule out medical issues. Encourage children to participate in preparing their own foods. They can kind of choose and make their own meals. They can help participate in food shopping, writing a shopping list, making meals for other people in their families, packing their own lunches. At a certain age, a child should be able to participate enough to make their own lunches. So encourage that, make that part of like what a child's chore is or what's expected at a certain age. Encourage a child to taste foods, but allow them to have food preferences. We all have food preferences. It's okay if your 13 or 14-year-old has food preferences. I always say child needs to taste a food a certain number of times as they get older before they can tell me that they like it or they don't like it. So one and done doesn't work. You need to try a food 10 or more times before you can tell me, that's not a food I really like. Make sure that they can open all packaging. So consider different containers, putting food in, maybe a Ziploc bag that has a little slide or a Tupperware container that has like a very easy to pull open lid. You can make small cuts in bags to help kind of open if your child's having some difficulties being independent because of fine motor skills. They have a lot of social skills groups related to food. A lot of schools have like a lunch bunch too, so that's something that you can talk to school about. Some of the social skills groups are like cooking related. They go out to restaurants for social activities. They do like food shopping and cooking together. And again, make sure that you're working with your child's team. Definitely for older kids, considering behavioral interventions to address anxiety around eating is very, very important. As some of these behaviors at a younger age might be more sensory related, as they get older, often become more related to anxiety. Next slide. For oral care, social stories, videos, picture schedules, having your child watch others brush their teeth can be helpful. Hand over hand help, so a child can brush their own teeth, can sometimes be helpful. It also might help them learn the motor patterns. A lot of children with autism have difficulty learning those motor patterns. Create a routine around toothbrushing and stick to it. So I say like, toothbrushing happens at one place. Oral care is followed immediately by something the child likes. Don't schedule something a child really likes before maybe toothbrushing if it's hard for them, because they're always going to feel like you ended my favorite thing to go brush my teeth, and so now I'm going to hate it even more. Timers are great. Using a specific song for toothbrushes. They have toothbrushes that flash. They're like a little timer. They change colors, or they go from green to red. So a child knows when toothbrushing starts and ends. A lot of times with toothbrushing, the anxiety comes with, I don't know when it's going to stop. So, giving the child something that can help them know when it's going to stop can be helpful. Consider, different steps of each oral care. So can they reach the sink? Can they open the toothpaste? Can they put the correct amount of toothpaste on a brush? You might want to try different kinds of toothbrushes. The next slide has some pictures. Toothpaste, you might want to use a gel toothpaste versus a cream. They have all different kinds of toothpaste flavors now. They have tasteless toothpaste. Sometimes they'll say use mouthwash instead of toothpaste because kids don't like the texture of toothpaste. And they have different kinds of things that you can use for flossing and cleaning your tongue as well. Next slide. Heavy work activities prior to hair care can help a child maintain a calmer body. Again, using social stories and narrating, allowing to see a child what you're doing for each step for hair care. So if you're styling or cutting their hair, teaching a child to brush their own hair. They can practice on adults, friends, dolls, etc. I always say for a lot of these activities, if you can teach a child to do it themselves, then they can grade the amount of sensory input that they're getting, and that can really help with their tolerance and acceptance. Don't underestimate the value of conditioner and detangling spray. Sometimes I'll use weighted lap pads or other distractors that are only for haircuts or hair styling. And then they do make quiet clippers and buzzers. You can find them on Amazon. They don't make the same sound as most clippers do. And then you could also try scissors instead of cutting hair with buzzers. Next slide. For nails, cut nails when soft, so maybe after a bath. They make these really great baby safety scissors. They're a little bit less unpredictable than sometimes nail clippers can be. The big thing is to really apply firm pressure to your hand and then the nail bed before and after cutting. Desensitized touch to hands if your child has those sensory sensitivities, so heavy work tasks, using textured washcloths or a weighted lap pad, using certain distractions, again, that are only for nail cutting, social stories and warnings. Again, letting a child know when it's going to start and end, just like toothbrushing, can be really helpful in decreasing anxiety. And then eventually work up to teaching children to cut their own nails. Next slide. These are some pictures of the toothbrushes. I think they just got moved out of order. These are some of the brand names, and then you can search for something called like a U-shaped brush. The one with the tiger is electric, and the two on the right are just regular. Next slide. These are some nice, they're three-sided toothbrushes, so they go around all surfaces of the tooth at one time. So again, you can kind of move in and out pretty quickly. Next slide. For deodorant and shaving, speak to school, especially as kids get older. A lot of times they do have some rules regarding like when children need to start wearing deodorant or start managing some of their facial hair. So this can be something that the whole classroom can do. It also can be something that maybe nurse or in like a health class they can start to talk about, kind of making it like all children need to be addressing and doing these kinds of things. Again, social stories, written schedules, videos, allowing your child to watch you get ready is really helpful. Be really mindful of scents and textures of deodorants and shaving creams and lotions. Obviously, have your child, smell different products and kind of make the determination of what things they find pleasant or what products they like the way that they feel. Make sure that your child has access to deodorant for gym time at school and maybe any other activity that might cause excess sweating. So, maybe teach them, you can get like really cute little sample sizes or travel sizes that can be a little bit more discreet that they can carry with them. And then for shaving, try a variety of tools. Standard razors, electric, you can use creams, you can consider laser treatment. They have the little stones that you can rub that can also help remove some hair. Next slide. Toileting, again, ruling out medical issues in toileting is huge. Look for readiness cues. So does your child, are they annoyed if their diaper is soiled? Are they removing their diaper on their own? Can they let you know in some way that they had a bowel movement or that they urinated? Decrease the physical limitations for using a toilet. Make sure that the seat opening is not too large. They have those great little inserts that can go on top of a regular toilet. Make sure a child's feet are supported when they're on the toilet. A lot of kids don't like sitting on an adult toilet because they feel unsafe. They don't have the postural strength and control. So using like a squatty potty or just a little stool underneath a regular toilet can be helpful. Also using less like one of those little tiny child size toilets that sit on the floor can also be helpful. Make sure a child has manageable clothing. This is important for all ages. So if your child has really hard time with buttons and zippers, don't send them to school in pants that have buttons and zippers because you might be asking for an accident or for them to be frustrated or avoiding going to the bathroom because they can't do everything independently. And then really look at the bathroom, have your therapist kind of help to bathrooms at school, bathrooms at home. Is there something that might be anxiety producing? So something sensory factors. So the wall's too shiny, is it very loud and echoey in there? Because there's no carpet, etc. These are things to consider. Next slide. More social stories and charts with steps for showering and bathing. Be mindful of the transition in and out of the tub. If bath time is not preferred, avoid moving bath time, avoid going into the bath after a highly preferred activity. So you want to then follow bath time with something that's very, very highly preferred. If bath time is highly preferred, complete less preferred tasks before the bath. So use that bath as a reward and use a timer to help a child transition from the tub. Again, look at the bathroom environment. Are there some sensory aspects of the bathroom environment that might be overwhelming for the child? And trial different water temperature, shower sprays, soaps, washing aids, and towels. Next slide. There is a slide somewhere I think everything got moved around, are just some things to kind of help in the bath. A lot of children feel really unsafe sitting in a tub. So consider a small bath seat or having your child sit in a laundry basket. That's my favorite for young kids in the tub. If your child is fearful of tipping their head back, a lot of kids with autism have just, I call it like gravitational insecurity. So there's like changes in their head position. Handheld shower heads, that Yokudu shower bath toy actually just like goes in the water, has a little battery operated thing that pumps the water into the spray. So it kind of makes like a handheld shower from a bathtub. And then I also make things that are like shower caps that go around to kind of prevent water from going into kids' eyes. I also work really hard on teaching kids how to cover their own eyes with like a washcloth and things like that. For things like menstruation, really educate your daughter ahead of time before this is going to happen. Speak to, her doctor, nurses at school and things like that to kind of have her know what's going to happen. Social stories, schedules. Autism Speaks has a lot of great toolkits on this. Have her watch You Manage Your Period Needs and practice off of herself first. So if she's going to be using pads, can she do a pad in underwear off of herself? They also have female anatomy models to kind of help if she's interested in using a tampon or a menstrual cup instead, to kind of practice off of herself in that. Timers, alarms, we can do so many things now with our iPhones and our watches, just as a reminder to change her pad or change her tampon, just to make sure that everything is removed and changed to manage hygiene. Always have extra underwear, pants, wet wipes available. I always say make a to-go pouch that like she can have in the community or at school that's always available. And a lot of, you want to try different pads and period underwear, cups, tampons. A lot of these companies will offer free samples, like our first period kit. So you can send out requests for that. You can talk to school nurses, doctors, Planned Parenthood can sometimes be a good resource to get some free products as well. Next slide. I know I'm going a little over time. I'm so sorry. Washing hands, again, pictures, written schedules are great. Visual and auditory timers or songs can also help a child know how long to wash hands. We all learned that during COVID. Sing happy birthday. These are great things that we can teach our kids too. Try different soaps and tools. So some kids really like gel soaps versus foamy soaps, and some like to use a sponge or a loofah to scrub their hands, and some do not. Bring a napkin, teach your child to dry their hands on their clothes if you're out in the community and they hate hand dryers, and separate water play from washing hands, because I do see a lot of kids that are like obsessed with playing in water, and we want to teach them there's a time and place for playing in water, and there's a time and place where you need to get in and out of the bathroom quickly. You're expected to wash your hand. One thing that was on the toileting that I think somehow got removed was to bring a sticky note with you when you go out, to cover the little sensors for those automatic flushing toilets. Teach your child to carry one or two of those around with them as well, because public toilets especially can be really anxiety producing. I know just in the hospital, each bathroom has different types of toilets and the way that they flush. So as a therapist, I'm very mindful of telling families like that toilet self-flushes, that one you can do yourself. So it's important to help your child learn how to manage different types of toileting environments. You're going to work on using a toilet properly, like sitting. Sometimes I'll have a child practice sitting on the toilet with their diaper. You can sometimes cut out, a hole in the diaper that gets bigger and bigger and bigger. So eventually the urination or the bowel movement will go into the toilet bowl. Sometimes kids just really don't have the feeling. They don't know when they're wet or dirty. So sometimes just wearing regular underwear and then putting those like plastic pants on top will kind of trap a bowel movement or urination in against their skin, and it kind of increases the awareness of that. Teach them how to clean up themselves. Wet wipes are always helpful to have. I have kids practice like on themselves, like wearing like biker shorts or things, and then spreading peanut butter and Nutella where they would have to wipe when they're toileting, and have them kind of practice. That can be fun for them. Try different kinds of underwear and fabrics. offer underwear breaks at home. If your child is someone that just like really hates wearing underwear, let them have the home be, okay, you don't need to wear underwear at home. And then have certain rewards or toys that are only available with toilet tasks that aren't available like in other activities. Next slide. Okay. Speak to your EI team or your school IEP team about having self-help goals written into your child's plan. For older kids, one of the big thing I hear a lot is that children are not independent with their self-help needs, but school won't provide support for that. So I always say, go in armed saying they need to change their clothes for gym class. They need to be able to get their coat on and put on their mittens and their hats if it's cold out. So it is something, you know, they need to be able to manage their clothing for toileting. So those are all things that can impact a child's education. So I really encourage you to speak to your child's school teams about doing some of these self-help skills, especially things like hygiene as they get older with body odor and things like that. And then the biggest thing I always say is don't practice other skills like working on clothing fasteners when a child is learning another skill like toileting. So if they're learning to use the bathroom, don't also make it more challenging by having them have to work on buttons and zippers on their pants at the same time. Okay, so I know that was a lot.